So what are the key things you tell patients about diet that you think are really valuable for them to hear more than what they don't want to hear, which is lose 15 pounds?
Yeah. Well, so the key, this is my everyday. I have specific appointments that are set up that look at nutrition. So, and hopefully this isn't something I'm trying to keep to myself. If this is something that y'all find is helpful, please use this strategy. But the first thing is making sure we set up the expectations. We have evidence that suggests that a 10 to 20% weight loss for individuals whose BMI is over 30, that a 10 to 20% weight loss is going to have up to a 20% improvement in knee pain. And that 20% is based off of a patient-reported outcome, VAS, KOOS, standardized to 10 points. So make it a multiple of 10. So it's not 20% of where you were, it's 2 points on that scale. That's awesome, but it isn't 100%. So if you have 6 out of 10 pain at rest, I'm not, weight isn't going to take you down, likely to a 0. It'll bring you down to a 4. So we set those expectations up. The other thing we do is I tell them, I'm going to go through a list of strategies that my patients came up with, because we actually had a group. We used to do group appointments when I had a certain space. We'd have 4 patients come in at a time. And it was essentially, for the majority of them, it was Weight Watchers. It was accountability, the clear setting of a goal, the use of a calendar to track that goal, and then only focusing on one strategy at a time. Because if you, and we're down in Tennessee, but a lot of people go to church and then their pastor's telling them about, eat fewer calories. And then they go to work and someone's telling them about how we could change the timing of our food with something like intermittent fasting. And then you go to your friends and they tell you about, well, you know what I did is I cut out all the carbs. I'm only eating vegetables. I'm vegan, I'm paleo, I'm keto. And then you try and take one piece of all of these things. For breakfast, you do this. For lunch, you try that strategy. But it's the dilemma of good decision making. If what you're doing does not adequately address the root issue, then any portion of it is incomplete. The story of Solomon. You cut a baby in half, you got no baby. It's not like bread. You cut bread in half, 2 people get a half loaf. When it comes to weight loss, my experience is if you try and cut your effort between 2 strategies before one is a habit, you're failing. You're failing at both. So what we do is we say, let's set a goal, and it is written out from 0 to 20% weight loss within a 2 to 6 month period of time, because that's what the research suggests, is going to help you get a 20% improvement in your KOOS scores. Now, you're going to lose some weight because that's one of the things that's going to go along with this. But I'm looking at it from a knee and hip function, outcome approach. That's what I'm looking at. And when they do this, they say, oh, I want to lose 5 pounds. I go, 5 pounds ain't it. Oh, I lost 5 pounds. That's good. No, the goal was 7. It's very clear on what good is and what isn't good. And because and they know I'm coming with love, nothing but love, but consistency. And they are my favorite appointments at this point, because unlike a surgeon who you may have people come in and go, hey, my knee's feeling great. Thank you, thank you, thank you. For me, when I do my treatment, that's the last I see of them. So all I hear is complaint, complaint, complaint. This hurts, that hurts, this hurts. Now I have currently 5% of my practice. The goal is to get it to 50%. 5% of my practice is just nutrition for weight loss and the treatment of knee and hip osteoarthritis. And they come in every month. And these are anecdotes, but I am going to stress the positive here. We have a mother-daughter team that came in. The mother, she chose to eat from a food standpoint. The strategy was reduce the simple carbohydrates. She changed her whole diet to meat and vegetables. She eats meat and vegetables for breakfast, lunch, and dinner. What she makes at dinner, she saves it for breakfast and lunch the next day. Most Americans aren't used to that idea. She's lost 19 pounds in the first month. She's already down greater than 30 pounds at the 3-month mark. And her knee scores have gone down dramatically. Is there placebo? Heck yeah, there's placebo in there. Is there actual improvement in her knee pain? Yeah, there's improvement in her knee pain. Did she also 6 months ago get a steroid injection? Yeah, but we know that's going to wear off if it didn't already. So she has gone from a KOS in the 30s up to a KOS in the 90s. She is not using her cane. She is not using NSAIDs anymore. She has lost over at this point more than 30 pounds because she's on track to do so. And she, I didn't start with the initial. She started off at, I'm getting her and her daughter mixed up. I believe she started off at 287 pounds and her daughter started at 310, 312. And her daughter's on track also. So like, it's this awesome approach that focuses on set a goal, pick one strategy, journal it, and then and ultimately make sure that we're staying on track. If you had the time, if you wanted to share the screen, I have the flyers that we hand out up, and I can kind of show those here. But you know,
that definitely tests my Zoom capabilities.
That may not happen. Yeah.
Yeah, the last time I tried to share a screen during a conference, everything went blank for about a minute. So
that's right. Yeah. Well, if as people follow you online and on Twitter, I'm actually live. I pre-scheduled some live tweets, so these things are actually going up as we speak right now.
I'm sure Nirav is tweeting right now too. So
perfect. Where am I? Yeah. Where am I? Where's my equipment? That's not my train. So, yeah. But